15 for Informatics 171. My name is Candy.
I'm Jasmine.
I'm Danica. Ciao. And I'm Amberly.
In today's video, we will be talking about crowdsourced labeling as it pertains to healthcare. We will talk about the first article called Learning from Crowdsourced Label Data, a Survey. Crowdsourced labeling is the use of ordinary internet users to label data, which can be advantageous. An advantage is that ordinary internet users are able to solve problems of which machine intelligence cannot solve. An example of this is the system reCAPTCHA. Another is that crowdsourcing can also help divide large tasks into small ones, which can prove to be more accurate. The quality of labels and learning models is the use of human intelligence in order to map the features of an object. Even though the crowdsourced labeling is promising, it suffers from low-quality labelers. Label quality and learning model quality are used in order to reveal the accuracy and prediction performance of the crowdsourced labeling. In order to improve label quality, a mechanism of quality control on task designing helps to regulate behaviors of labelers by guiding them. Another is quality improvement after data collection by introducing algorithms to induce an integrated label. Such an example of this is ground truth inference algorithms.
Challenges of learning from crowdsourcing include the different expertise and dedication of labelers, which make ground truth inference algorithms perform inconsistently, open nature of crowdsourcing, making it difficult to sort through labels, quality control of crowdsourcing, bias labeling because they are difficult to detect and harmful to the inference algorithms and training models, and spam and advertisable labelers who tend to provide fixed labels or incorrect labels even though they know the right ones.
Ground truth inference is a process of estimating the true label of each example, and the problem is that we need to obtain an integrated label yi hat to each sample I. There are different inferences based on EM, algorithm based on maximum likelihood estimation is now considered to be a good model to analyze the error rate. And also it can be based on linear algebra and statistics, which aims to interpret ratings of user-generated contents. And there are other inferences such as S-filter to filter out low-quality labelers in active system. Here indicates the different algorithm, main function, label type, method, reliability of labeler, difficulty of example.
In regard to crowdsourcing, the data come from realistic demands or requesters. This comes with the expectation that the contributions will be rewarded. This increases the quality of data, and as a result, the lead will have the most valuable information possible. In addition, open source tools may be used. These are tools that are freely available for its users, and they are able to control and modify by use and allow for redistribution on their own terms.
Crowdsourcing has greatly alleviated the contradiction between the demand of learning models and efficiency of the training data. However, the quality and accuracy of gathered data is questionable due to labelers. More research needs to be done in order to improve learning from crowdsourcing. This includes the fine-grained inference methods to improve the accuracy of inference, more learning models to improve and increase effective multi-class and multi-labeling research in crowdsourcing, more deeply the relationship between the label quality and learning model quality, because finding more valuable examples and accurate labels is helpful in making a trade-off between cost and quality of learning models, and theories of learning from crowdsourcing labeled data.
The article found that one type of software lets healthier white people into the programs ahead of black people who are less healthy because it determined level health risks based on their healthcare costs. However, due to structural inequalities in the health system, more money is spent on white people, and the algorithm then based their risk on how much money is spent on them, rather than their actual health. This means black people are in poorer health at any given level of risk than white people at the same level of risk, since their health is less spent on.
Crowdsourcing is a much more complicated problem than it seems. It uses multiple different ground truth inference algorithms to measure the true labels to examples. Even though I don't quite understand what this symbol means, they seem very complex and take years to build up the reliability of the true label yi hat value.
Crowdsourcing, in theory, is a great idea. However, the execution of it is seemingly almost impossible on controversial issues. Due to bias and the source of labels, algorithms will find it difficult to determine what provided and gathered data is correct.
Algorithms have potential to streamline a lot of time-consuming processes, but they also need some human intervention to account for outliers and complex factors. Basing the algorithm on flawed data influenced by human error and bias results in a system that is also flawed and biased.